Hi, I'm Dr. Jen. I'm a fertility doctor. So I'm here live and I'm going to answer your questions. Or if I don't get any questions, I'll answer some questions I got on our comments that I got on this channel or on TikTok. But feel free to ask me any questions in the chat, any fertility related, trying to conceive early pregnancy questions. I can answer any of that for you. So feel free to ask any questions in the chat. Um, Hi, Dr. Jen. I'm a fertility doctor, so I'm going live on TikTok as well. Please feel free to ask me any questions that you have, any fertility questions, anything related to fertility treatment like IVF or IUI, anything about trying to get pregnant. Yeah, please feel free to ask me any questions that you might have, and we'll go over them. Um, Let me go and review some fertility related questions that have come up on my page here, like comments that folks have left on my page. So let me review some of those. Okay. Let's see. Okay. So I have a video asking about HCG rise in early pregnancy. That is a popular question I get. Like, how should your pregnancy levels or your beta HCG levels rise in early pregnancy? So they should about double for every 2 or 3 days. So it doesn't have to exactly double. It should go up by minimum actually 1.6 every 2 or 3 days in early pregnancy. So that's at about when you're between like 4 to 6 weeks pregnant. And then after 6 weeks, it tends to plateau. So it's not as helpful at that point. We use more ultrasound because you should see the pregnancy in ultrasound around 6 weeks. All right, so I'm getting a lot of some comments here. So my HCG was 112, then 260, then 637. Yeah, I mean, you want to it's important to know how far apart those were, but those are as far as I can tell, looking good. Those are about doubling, or over doubling. So it depends again how far apart they were. Those should be like really 2 or 3 days apart. And if that's how far apart they were, then when they were drawn, then those levels look good. Absolutely. Let's turn up light. It's not so bright. Yeah. So someone has a question about their prolactin levels being elevated. So high prolactin levels can decrease your fertility. Sometimes you'll see it where your period's not regular, but sometimes just the elevation itself can throw off fertility or implantation. So it is good. I like all my patients to have normal prolactin levels when they're going through fertility treatment. So so there's medication you can take that's safe to take while you're trying to get pregnant that will get your prolactin normal. Usually you need a workup too to check an area in your brain where the prolactin's made to make sure that's okay. And then you can take a medication that will bring your prolactin to normal levels. That's really safe to take when you're trying to get pregnant. And that should increase your fertility. Or Lissa for 2 months is enough for receptiva score. So actually, I just had this come up with a patient of mine. I just want to make sure the light's not too bad. So receptiva is about, it's a test of the endometrium. So why do we do this? So when you've done IVF, you have an embryo and maybe the embryo is not implanting. This is a test that measures inflammation in the lining of the uterus. That can happen. This test is measuring inflammation that happens because you have endometriosis or you have fluid in your tubes and it's leaking back into the uterus, that's hydrosalpinx. So it can happen for those reasons. And usually it's treated with Lupron. So that is an injection, a once a month injection that you take, and you take it for 2 months. So the timeline sounds good. And what Lupron does is suppresses, like, basically it's supposed to suppress the endometriosis. Now, Orlissa could possibly do that too. Orlissa is nice because it's a pill. And the 2-month course sounds good. I'm just not aware if there's been good studies showing Orlissa does the same thing as Lupron in terms of correcting your score, and also they haven't really looked at it correcting the score of the inflammation, but they've looked at pregnancy rates go up, miscarriage rates can go down if you treat for 2 months, but usually that's with Lupron. Okay, let's see. My doctor found 3 polyps on my SAS. Does this decrease my chances of pregnancy? Okay, so what this means, just as an explanation overall, so that is a water ultrasound, and basically it's done in the office. And what it does is it puts water inside the uterus. The uterus is a closed space, so water opens it up so you can look all around at the lining of the uterus, and there can be little growths or polyps in the lining of the uterus. And I kind of describe that as the lining of the uterus is where the embryo implants and grows. It's kind of like the soil for the embryo, and the polyps are like little rocks in that soil. And so ideally, you don't have little rocks in the soil when the embryo is trying to implant and grow there. And so, yes, they can decrease your fertility and decrease your chance of pregnancy. And they seem to cause like inflammation through the cavity of the uterus. So as a fertility doctor, if I see polyps on one of my patients, I remove those polyps to increase their fertility and chances of pregnancy. I would remove them before an embryo transfer to increase the chances of the embryo transfer working as well. So let's see. Yes, cabergoline is the medication used to treat the high prolactin. That's right. That is correct. Could your temperature drop on the Oura ring and still be pregnant? Yeah, it's possible. I mean, basal body temperatures are nice, especially when they're measured by the ring, but they're not honestly at 100% accurate. As you know, they can be a little finicky, a little tricky to measure, I would say. So I wouldn't worry about the Oura ring if you're pregnant. But you know, if you're having signs like cramping or bleeding and you're concerned, then you can get like pregnancy levels measured. If you're concerned and having other symptoms, but as a doctor, that wouldn't concern me about like in terms of being pregnant. Okay. And what's the, they recommend a hysteroscopy, but I'm scared of anesthesia. Yeah, I know. Anesthesia though is really safe, especially for young, healthy women, which most women seeking fertility are. So I will let you know that there is a type of hysteroscopy where it's like there's a brand called Endoc, which is really small, which can be done in the office, but it's not offered everywhere. And you can do that without anesthesia. But it is like a crampy procedure. It's usually done with anesthesia. But have I ever done it for a patient without anesthesia? Yes, with a little camera called an Endoc. Yay, congratulations on being pregnant. 15 weeks pregnant, that's good. The highest risk of miscarriage for pregnancy is in the first trimester up until about 9 weeks. So if you're beyond 9 weeks, your risk of miscarriage really goes down as well. So congratulations. Okay. Okay, so I'm transferring a 5AA next week, about to start PIO injections and prometrium capsules. So that's, she's referring to, is referring to the type of embryo that they're transferring. That's a blastocyst embryo that's rated well. And you usually take progesterone before your embryo transfer. So good luck with your embryo transfer. And then Madison says a transfer with a PGTI and SR normal embryo ended in a blighted ovum. I'm sorry, that's it's so hard when that happens. Can it happen again? It's possible to happen again. I will say, in my experience with my patients, it doesn't usually happen again, but it's possible to happen again. So a PGA tested, SR tested embryo has the correct number of chromosomes. It doesn't have any SR structural rearrangements or like flipped chromosomes, so it doesn't have any flipped chromosomes by the testing. But there is still a chance of miscarriage with those embryos. It's lower, maybe like 7-8% chance of miscarriage. So it can happen with those embryos. But it's not the most common thing to happen. So it's possible to happen again, but the most common thing that would happen next if you transferred another embryo like that would be that you have an ongoing pregnancy. That being said, you want to make sure you have all your uterus checks done. You want to make sure your protocol for your embryo transfer is good for you. Your progesterone levels are good. So usually I'll do a little bit of a deeper dive for my patients when they have a miscarriage after that type of embryo transfer to make sure we're not missing anything else that could be contributing to a miscarriage. But again, most commonly, should not happen again. Okay. Hi, is day 5 better than day 6? Like a day, I would think you're referring to, this is Lumi Lou. I think you're referring to a day 5 embryo. And so I did a little video on this actually just this week about which embryos have higher pregnancy rates, implant better. So embryos can reach the blastocyst stage on day 5, 6, or 7. Day 5 is thought to be the optimal stage, but to be honest, there's not much difference in pregnancy rates between day 5 and 6. Now, if we can't decide between two embryos, we would choose one that made it to blastocyst on day 5. But in general, they have similar pregnancy rates. You do see a drop off in pregnancy rates for day 7 embryos, though. So that's important to keep in mind. Leila says unicornuate uterus and trying to conceive. So unicornuate, so the uterus, that means the uterus, when you're an embryo, the uterus is like split into 2, and then they usually merge, and then in between that septum disappears, and you have more like a uterus that can be shaped like this. In unicornuate, they don't merge, you just have one piece of the uterus that continued. So you can get pregnant with a unicornuate uterus. I have had patients get pregnant with a unicornuate uterus, so it's possible. But you can also, the pregnancy is at risk of like early delivery, just because there's not as much room in that uterus when it's not as big as like one that has merged and has more space. So it's possible to get pregnant, but there can be more complications with the pregnancy. So I am going over here. Yes, let me know here on YouTube if you have a question. I'm getting a lot more questions on TikTok, but I'm happy to answer any on YouTube as well. So let me know if you have a question. I'm happy to answer you. Okay, so let me go over here. Okay. Hey, Maria says I finished my first medicated cycle with letrozole and Avidrol and found out it worked today. Yay! Congratulations. So I had a lot of questions about IUI. I don't know if you did IUI or intercourse. So when you take letrozole, and then that's a pill that you take for 5 days usually, and then Avidrol, which triggers the injection, and then you can either have an intercourse. Usually when you're using Avidrol, you would pair that with an IUI or intrauterine insemination to increase your chances of pregnancy. And there were a lot of questions on my last live if it's possible for to get pregnant the first time you do that. And so there you go. There's an example. Congratulations. Haley says, I had a euploid implant and then a chemical. Again, I'm sorry. This is so hard when this happens because you've been through so much to get that euploid embryo. It's so hard. And what can I do for my next transfer? All day 5, 3 AAs. So that's amazing. Those embryos sound amazing. I don't know if they've been tested by PGTA. So that's possible because even though embryos can look really good under the microscope, they we don't know about the chromosomes. So even embryos that looked like really good, sometimes the chromosomes will not be good. It's more common as you get older, over 35, really common over age 40. So that's something to consider. You want to make sure if you know about the embryo's chromosome makeup, that's important. If not, then how I commented before, I really like to know and make sure everything with the uterus is okay. So I want to make sure that you've had a uterine check, like either an SIS, so we were talking about before, a hysteroscopy, to make sure you're not missing anything in your uterus as well. And then, of course, you want to make sure your protocol for your embryo transfer is good, your progesterone levels are good. So these are some things I think about. But good luck with your next transfer. Okay. Let's see. My doc kept me on like 2.5 milligrams of letrozole, I think, because I ovulated, but my follicle check was only 14. I think you mean like your follicle was 14 millimeters and you ovulated. It's not always due to the letrozole dose, so it's okay. You don't always have to increase. Increasing the letrozole dose won't necessarily increase the size at which the follicle ovulates, but that is early. I agree. You want ideally for a letrozole cycle with timed intercourse or IUI, you're looking for a follicle to be 18 millimeters or 20 millimeters. Topical progesterone creams post-ovulation. If you're doing that to, it depends why you're doing it, but basically if you're doing it to, usually it's done if you have like low progesterone, because in the second half of your menstrual cycle, that's when you produce the most progesterone. Or that's when your body naturally produces progesterone. It shouldn't be there in the first. So you got to be careful not to use the progesterone cream in the first half of your cycle before ovulation, because that can actually decrease your fertility. So that's important. But creams, they don't, we're looking for progesterone to get to the uterus, right? So creams don't get progesterone to the uterus as well as actually vaginal progesterone. It gets to the uterus much better. It's supplied to the uterus much better that way. Even taking progesterone orally isn't always as good as taking it vaginally. And the same thing with topically, that it doesn't, if you're doing this for fertility, for pregnancy, then usually we'll use it vaginally, actually. Okay. Thank you. Thank you everyone for leaving so many so many comments. This is great. Does IVF boost fertility? I failed IVF and got pregnant naturally in the next month. Yes, IVF does boost fertility. I've seen that happen a lot. It probably boosts like hormones. It boosts like blood flow to the uterus. So yes, I have seen that. It does seem to boost fertility. My AMH is 3, my FSH is 6. My fertility doctor told me I have a 25% chance of getting pregnant. That's a great AMH, so that means you have a really good egg supply. I'm not sure what the 25% refers to, maybe per month or 25% with a certain type of fertility treatment, but that would be per month, I think, because, depending on your age, that is a good AMH. So overall, your chance of pregnancy beyond 1 month would be higher than 25%, I would think. Okay. The kids from the same egg retrieval often have very similar genetic characteristics. Well, eggs from the same woman would produce babies with similar genetic characteristics, but not necessarily from the same egg retrieval per se. see. Thanks for all the questions. Um, do you recommend fibroid removal if there's 2 over 6 centimeters and failed 2 transfers? So fibroids, they grow in the uterus, and over 4 centimeters, that's when we sometimes consider removing them. Although we always take the decision for surgery very, heavily. We don't take it lightly. So it would depend. It also depends on the location, because sometimes if they're located going into the cavity, where they like stick into the cavity a little bit, it's much more important to remove them for fertility reasons. You can have a fibroid that's hanging like off, even off like a little stalk off the outside of the uterus. That's really less likely to affect fertility in that case. So it really depends on exactly where the fibroids are located, whether it makes sense to remove the fibroids. Um, 11 days post IUI number 2, sperm counts and motility looking good. Okay, well, that's good. I had 2 follicles that looked good sizes. That's also good. But listen, 11 days can be a little early to test. So that could be why you're testing negative. To really like make sure we're seeing a positive, we usually will say like 16 days past the IUI to make sure we're waiting long enough that we don't get like a false negative, because it's possible, could be that you're just testing too early. So I would recommend waiting and testing again at a later date. So thank you all so much for joining this live. I actually have to jump off now, but I really appreciate all the questions that you have. I'm going to be trying to do this more regularly and do it regularly next week. So thank you again, everyone, for all your questions, and just keep your eye out, because I'll keep trying to do these lives on a more regular basis so I can answer everyone's questions. Okay. All right. Take care. Bye. So on YouTube, I'll try to schedule these and have these more regular. I didn't get a lot of questions on YouTube, but please follow me, because there's not a lot of questions. So next time anyone asks a question on YouTube, I'll be able to answer it, because I'm not getting a lot of questions here. So definitely, definitely feel free to ask me questions. I'm going to schedule some more lives next week.